Today is a very important topic, and I hope you would find this lecture meaningful. Okay, so today I would be discussing mental and behavioral disorder use due to psychoactive substance use. Mental and behavioral disorders due to psychoactive substance use. Okay. So psychoactive substances are the substances which cause, addiction. By the end of this lecture, you shall have basic knowledge of various disorders due to psychoactive substance use, diagnostic criteria for drug dependence, causes of drug dependence, and management of drug dependence. Okay. So, as you're aware, drug dependence is a big problem in the society, and it is also, increasing in students. Uh, Here is a survey carried by United Nations in 2013 in Pakistan, which reflects the scope of the problem. Okay, so there were 6.7 million users of drugs in the last year, which makes 6% of the population. 4 million people use cannabis, 89 million heroin, 32 million opium, and similarly cocaine, methamphetamine, tranquilizers, and injected drugs. Okay, so the other drugs are also used by various people, but I have not given the detail. The number of people using those drugs is small, and the majority was between 25 to 39 years of age. As you might be knowing, methamphetamine, which is called ice, has been increasingly used among the young population in our country. So, scope of the problem is very large, and each year 40,000 new people are added to this list. Okay, so by now I think more than 8 million people might be using drugs in Pakistan, and there are various uh, substances, uh, psychoactive substances, including alcohol, stimulant drugs like caffeine, cannabis, cocaine, hallucinogens, volatile solvents, tobacco, opioids, sedative or hypnotics, and many people use multiple drugs. So each drug can lead to various mental and behavioral disorders, psychiatric manifestations, which include drug intoxication. The patient may present with, intoxication, harmful use. We would see what is harmful use, and dependence syndrome. We would see the criteria for dependence syndrome. The patient can present with a withdrawal state. Now, each drug has a different withdrawal state depending on the neurotransmitters which it is mainly affecting. For example, uh, people who are dependent on alcohol or benzodiazepine can present with epileptic seizures. Okay, so different drugs have their own characteristic withdrawal state, and there can be withdrawal state with confusion, and drugs can cause psychotic disorders. Schizophrenia-like picture can arise due to drugs. For example, with the cannabis, uh, there's 4 times more chances of developing a psychotic disorder or schizophrenia. Amnesic syndrome, uh, especially in alcohol, and there can be other disorders which can arise due to drugs like anxiety disorder or depressive disorder. So here we would be focusing on harmful use and dependence syndrome. Okay, so what is harmful use? Harmful use of a psychoactive substance is a pattern of psychoactive substance use that is causing damage to health. The damage may be to physical or mental health. So, if somebody is using a drug like alcohol and his physical mental health is being affected, then we would call harmful use. He might not be dependent on alcohol, but still the use is harmful. And what is dependence syndrome, which is called uh, drug addiction? Okay, so there are two systems of classification. Uh, One is international classification of diseases, which is used internationally, and it is called ICD. Currently, ICD-10 is in vogue, but new edition of ICD is coming. That would be ICD-11. And there's also American system, which is called Diagnostic and Statistical Manual. Okay, and its fifth edition has come. So these criteria are according to International Classification of Diseases, 10th edition. Okay, so diagnosis of dependence should be made if three or more of the following have been experienced or exhibited at some time during the last year. There's a strong desire or sense of compulsion to take the substance. There is difficulty in controlling substance taking behavior in terms of its onset, termination, or level of use. So the person cannot control the onset, termination, or level of use of the drug. The physiological withdrawal state when substance use has ceased or been reduced as evidenced by either of the following: the characteristic withdrawal symptom for the substance, or use of the same with the intention of relieving or avoiding withdrawal symptom. So there would be withdrawal syndrome. Okay, for example, when a person who is dependent on opiates is having withdrawal symptom, so there is nausea, there is vomiting, abdominal pain, diarrhea, restlessness, and symptoms like that. So there is a characteristic physiological withdrawal state. And fourth is evidence of tolerance, such that increased dose of the psychoactive substance are required in order to achieve effects originally produced by lower doses. Okay, so the same dose would not be producing the same results, and gradually the dose has to be increased. And there's progressive neglect of alternative players or interests. and increase amount of time necessary to obtain or take the substance or to recover from its effects. So one might be interested in sports or other activities, and one stops taking interest in these activities. Persisting with substance use despite clear evidence of overly harmful consequences. So, three of these need to be present: that compulsive use, okay, loss of control in use, physiological withdrawal state, tolerance, neglect of other interests, and persisting with substance use despite clear evidence of overly harmful consequences. So, if three of these criteria are present, then we would say that this is drug dependence. Okay, and we would use the substance which has caused the dependence. For example, opiate dependence, or cannabis dependence, or alcohol dependence. Is it clear? So this is according to ICD-10. Okay. So the point is that not everybody who is using psychoactive substances is dependent on these substances. There might be no recreational use, which is not harmful use or drug dependence. So when physical or mental health is affected, that is harmful use, and when three of these criteria are present, then we say that it's drug dependence. Is it clear? Is it clear? This is not given in your book, okay? You can note it down. But this is the, okay. This is ICD-10 diagnostic criteria. So every illness has diagnostic criteria which is given in a book which is called ICD-10. So diagnostic criteria for drug dependence are that in the past year, these at least three of these criteria should be met. There should be strong compulsion, okay, and the person cannot control the drug use. There's evidence of withdrawal state, that when the person is not taking the drug, there's characteristic withdrawal state which appears. And there is evidence of tolerance, that increased dosages of substance has to be taken. For example, initially a person was taking 5 milligram of diazepam, then it is not working. Okay? He increases it to 10 milligram, then to 15 milligram, then to 20 milligram per day. So this is how increase in dose is achieved. Then he or she might be neglecting other activities, and finally he is using substance despite harmful consequences. Okay, a person might be using alcohol and he keeps on using alcohol despite the evidence for liver damage. So not every use is drug dependence. Okay, it might be a recreational use or harmful use or dependence. So what are the causes of drug dependence? So these are the main headings. That one might be vulnerable, okay. Second is easy availability of drugs. Third is causes in the social environment. And then different stressors. and there might be other reasons. So let's see what's the personality vulnerability. Okay, some people are more vulnerable to take drugs and become dependent as compared to other people. Okay, many people may go through very tough times, but they don't resort to taking drugs, while other people might, take drugs under, slight stress. So what is personality vulnerability? Genetic predisposition is important.
सिर्फ जगह चेंज कर दो जगह चेंज
क्यों?
फिर वो आवाज डबल होगी आवाज डबल होगी फाइनली
Excuse me, I am changing my place. Okay. अब ठीक है?
सर वो आवाज डबल होगी
अभी ठीक है?
जी सर
So in drug dependence, there's 50 to 60% genetic heritability. For example, in the case of alcohol, okay. So if there is a family history, then there are more chances of resorting to drugs. Then people who come from disrupted families, where there was death of parents earlier on, or there was divorce, or there were conflicts, or there was harsh parenting and things like that, deprivation, okay, childhood adversity. So that adds vulnerability to the personality. And trauma, whether it was emotional trauma, physical trauma, sexual trauma, or trauma due to a loss or due to a catastrophic event, so that predisposes one to the drug dependence. Then if there's a poor school record, truancy, delinquency. Truancy is that the child goes to school and never reaches school, but he tells at home that he went to school, but that is truancy. And delinquency is childhood conduct problems like fire setting, stealing, okay, things like that. So if there's poor school record, truancy, delinquency, conduct problems, then some people are sensation seeking and they are impulsive. Excuse me. They have an impulse to take drug and they cannot resist. Okay. Then various personality disorders, people with those personality disorders are more vulnerable. For example, borderline personality disorder, okay, antisocial personality disorder. So these disorders, the patients with these disorders are more vulnerable. Okay. Then drugs are commonly used to treat, self-medicate anxiety or depression. Okay. And other psychiatric disorders can also lead to use of psychoactive substances like bipolar affective disorder, schizophrenia. And when there is a comorbid drug dependence along with a psychiatric disorder, that aggravates a psychiatric disorder, and it's very difficult to treat. If a person with if a person with bipolar affective disorder is taking drugs, then the management becomes very difficult. So there's a lot of comorbidity, that there is a psychiatric disorder as well as there might be, drug dependence. So this is personality vulnerability, okay? Availability of drugs is important. So when they are easily accessible, like nicotine, cigarettes, Okay, and free availability of remedies containing opiates, cough syrups, and others. Prescription by doctors is a very important factor. For example, a lot of doctors prescribe uh, benzodiazepines, and then they don't taper off. Ideally, benzodiazepine should be tapered off after 4 to 6 weeks. Okay, and there are drug mafias working at various places, and they sell illicit resources. And nowadays, different uh, educational institutes have become, target for these mafias. A lot of drug is coming from Afghanistan into our country. So social environment can predispose and lead to drug dependence. For example, if there are, if there's poverty, unemployment, poor living conditions, okay, these can predispose to drug use. And if there's a drug culture, for example, in Karachi, drugs are, widely used in Liari because the culture in Liari is, such that it encourages drugs. Similarly, in Peshawar or in other places, there are certain places where, there's a drug culture. When I was studying in Hyder Medical College back in 70s and early 80s, uh, there was a hotel near our hostel, and that was called Chelsea Hotel. And church was widely available there, and people used to go there and used to smoke church. So when the drugs are easily available and environment is facilitating that, then there are more chances that people would abuse drugs and become dependent on those drugs. We have talked about childhood adversity, so that can predispose to drug dependence. And current stresses are important. For example, there's a sudden death in the family of a close family member. There's divorce. There's break of engagement or break of affair and hello. So current stresses can precipitate the drug dependence. And there are other reasons why people use drugs, and this is given in your book, okay? That they want to escape from painful reality and responsibilities. And peer pressure is very important. Peer pressure is very important. Sometimes youngsters start using drugs on peer pressure just to please their friends, okay? To avoid physically painful conditions. For example, if there is amputation or injury, so to cover that pain, people become addicted to painkillers. To seek novelty and thrill. And there are misconceptions like doing it once in a while does not make you addict. So people think that they would not get hooked, but they become dependent after using, say, heroin once or amphetamines or things like that. And some celebrities using drugs and they become, inspired by their celebrity. And many, many famous people have been drug addicts. For example, Michael Jackson died due to that. So there are many reasons for that. Okay, why people come to drugs, and one fundamental problem with people who use drugs is that they cannot regulate their emotions. Okay, in different situations they become very emotional, they have low distress tolerance, they have low stress tolerance, and they cannot handle their emotions. So there's a problem in the emotional regulation. Okay, and genetic predisposition uh, causes changes in the brain. Okay, and we would come to that. We would come to the reward system. So people cannot handle their painful external or internal reality. Okay, so they resort to drugs. Various drugs cause euphoria and sense of pleasure, so they act as positive reinforcer for different activities which lead to the use of drugs. Okay, and there is a change in physiological reward system due to increase in dopamine. So, as you are aware, that mesolimbic system deals with pleasure and reward, and it is concerned with dopamine release. So, most of the drugs release dopamine, the mesolimbic system, in the nucleus accumbens, and their surge in dopamine causes all the pleasure and all the happiness and all the excitement. Okay, then learning might also be playing a role. Okay, learning might be playing a role, and memory might be playing the role, and in this context hippocampus and amygdala are important. So there might be, conditioned responses. For example, a person who has given up uh, injections, he might, have conditioned response whenever he would see a syringe. Okay, or an alcoholic would have a conditioned response whenever he would see a bottle of whiskey. So uh, memories and conditioned responses, which are dealt with by hippocampus and amygdala, are also playing a role. Learning is also playing a role. Then tolerance and withdrawal is due to neuroadaptive changes in the brain. For example, GABA function in benzodiazepine and alcohol dependence, and in noradrenaline in opiate dependence. So, uh, whenever there is, uh, excessive neurotransmitters, then there is, down regulation of those receptors. Okay, and when the drug is withdrawn, then there's a decrease in level of that neurotransmitter and characteristic withdrawal symptom. So, what complications can these drugs cause? Can you can you tell me some complications which can arise as a result of drug use? Any complication which you might know? Where very good and very good, very good, very good. So physical complications, infections due to use of needles, okay? Health issues. So there can be, hepatitis, HIV, abscesses, cellulitis, okay? There might be falls, there might be accidents. So these are physical complications. Loss of weight, infections. Good, good. There can be psychiatric and psychological complications. Okay? Some drugs like amphetamines can give rise to psychosis. Cannabis can give rise to psychosis. Okay? Cocaine can give rise to depression. Okay? And many other drugs can give rise to anxiety. There are social, cultural complications. Okay, there is a stigma involved. There is, effect on family system. There is effect on relationships. There is effect on occupation, and there are financial problems. There might be legal problems, and this problem from the religious point of view. And one thing which I have not mentioned, that a lot of people, okay, succumb to these various complications, and there are a lot of deaths due to overdosages and complications. Okay, for example, people who are dependent on alcohol, alcohol leads to cirrhosis of liver. Okay, and amnesic syndrome. So similarly, there can be serious infections due to injections. For example, septicemia. So, and as you know that uh, people die of drug overdoses, especially these new drugs, these amphetamines, cocaine, okay, LSD, these stimulants, these all have serious cardiovascular effects, and death can occur. So overdosage can result, and death can result due to different complications. And one reason for death is that when a person who is dependent on drugs uh, develops tolerance, and he is fed up of drugs, he then seeks detoxification. And after detoxification, when he starts using drugs, he gets double pleasure. So in that enthusiasm, he might start with the larger dosages of a drug which he was using prior to detoxification, and that can lead to serious overdosage and death. So when people restart with the dose which they were using prior to detoxification, that can result in fatal consequences. For example, if a person was taking 4 grams of heroin before detoxification, and after detoxification he again starts to take 4 grams of heroin, that can become toxic dose. and lethal dose. So there are, number of complications, number of side effects, number of consequences, adverse consequences. And we would be coming towards this religious, spiritual side when we talk about the treatment. So now, we have covered the all psychoactive substances collectively. It is not possible to discuss single drug individually. Okay, so there are some differences between different drugs, but I've given you a collective picture. Okay, collective picture, and same would be true when we would be discussing the management. So I would be presenting a general scheme of management for different drugs. So what are the aims of management? First is comprehensive assessment. Second is raising awareness and motivation. Third is detoxification. Then is skill building and new perspectives, including spiritual awakening. Then is abstinence and relapse prevention and rehabilitation. So one by one, we will be taking these steps. Okay. As in other disorders and management, you would be doing all these things. Okay. You would take detailed history, take physical, mental state, and cognitive state examination. So, what would you ask in detailed history? कि जी आपने कब ये ड्रग इस्तेमाल करनी शुरू की, कौन कौन सी ड्रग आप इस्तेमाल कर रहे हैं और आप किस तरीके से इसको इस्तेमाल करते हैं. जब आपने पहली दफ़ा इस्तेमाल की तो उसकी वजह क्या बनी थी, और पहली दफ़ा जब आपने ड्रग इस्तेमाल की तो उस वक्त आपने क्या महसूस किया था, और बाद में आप किस अंदाज से ड्रग इस्तेमाल करते रहे. आया वक्त के साथ साथ इसकी मिकदार बढ़ती गई, और जब आप ये ड्रग इस्तेमाल नहीं करते तो कौन कौन सी अलामात होती हैं, और उन अलामात को कवर करने के लिए आप क्या करते हैं. आपने आपके एक दिन में कितने पैसे खर्च होते हैं. ठीक है जी. और आपने इस जो ड्रग है इसके कौन कौन से नुकसानात देखे हैं और कौन कौन से फायदे देखे हैं. और आप इस तरीके से भी पूछ सकते हैं कि जी आप अपना एक टिपिकल दिन बताएं कि सुबह से शाम तक आपका दिन कैसे गुजरता है और उस दौरान में आप कितनी ड्रग इस्तेमाल करते हैं. तो टिपिकल डे आप पूछ सकते हैं और इस तरीके से आप हिस्ट्री लेंगे. ओके. फिर then in the physical examination some aspects are important. For example, you would see needle marks, okay, or any other injuries. For example, the person who is dependent on alcohol, he gets head injuries and other falls, okay, and gets other injuries. And of course, in systemic examination, you would palpate liver and spleen, and look for evidence of infection. These people can also develop bacterial endocarditis. Okay, so you would auscultate the heart, and you would see the detailed mental state and cognitive state. Any delusion or hallucination or confusion or disorientation. Okay. Then detailed biopsychosocial assessment, and biological investigation keeping with the drug use and associated complications. For example, when the person is using alcohol, you would do the liver function test. Okay, so they would be raised SGGT and mean corpuscular volume, and you would do blood and urinary alcohol, and for other drugs you would test the urine for opiates, cannabinoids, and other drugs. So detailed biopsychosocial assessment, that's the first step in each disorder, okay? In each disorder. Then the same points, you need to establish a trusting relationship, need to give constant support, guidance, and non-judgmental, empathetic attitude. You need to set healthy boundaries, okay? This is with every person, but especially in drug dependence patients, you might, have some judgments coming into your mind. You might become critical. Please avoid that, okay? Please avoid that. These judgments are very detrimental, very, what should I say? Judgments are killing for the patient. Don't be judgmental, okay? Don't be judgmental. Don't be moralistic. Then you would raise awareness of problem for change, and you would assess the motivation, and you would raise the awareness. How do you motivate a person with drug dependence towards change? Any idea? This is a very difficult condition to treat. How can we motivate others? And if we have some bad habit, how can we motivate ourselves? But how can we motivate them? That they should seek treatment and should stop the drug. They would come with lot of excuses. They would rationalize their drugs. They would rationalize their behavior. Good. Sport groups, good. Good, good, good. Very good. So, rehabilitation program, very good. But before they agree for rehabilitation, they need motivation. We need to motivate them. There's a model which is called Prokaska chain model, okay? And there are various steps in this, various stages in this model. First stage is pre-contemplation stage. When the person is not thinking of, any consequences, any change in behavior. That is pre-contemplation. Contemplation is thinking, okay? Pre-contemplation. Then comes the contemplation stage, when the person starts thinking that what are the advantages of drug use, what are the disadvantages of drug use. So pros and cons, pros and cons. That is contemplation stage. After that, the person makes a commitment, makes a decision, okay, that he would enter rehabilitation and would stop taking drugs. So that is commitment stage. And after commitment stage, he takes action. comes to the hospital, becomes hospitalized, and gets detoxification, gets into rehabilitation. And then is a maintenance phase that he becomes abstinent and he maintains it. And in each of these stages, a relapse can occur. So a relapse can occur at commitment stage, at action stage, at abstinence stage. So pre-contemplation is गफलत वाली stage कि जब हम सोच ही नहीं रहे होते कि कोई problem है, okay? Yes, we will be coming to that. That is motivation. We will be coming to that. I'm just telling you the stages of change, okay? Stages of change. Pre-contemplation, contemplation, commitment, action, maintenance, and then relapse can occur. And how do you do motivation? First thing is your attitude, that you need to be non-judgmental and you need to show empathy. Okay? And you don't argue. You don't argue with the person, because the person would be using a lot of defenses. He would be defensive. He would be denying that he has any problem. Okay? He would be testing your patience. So don't judge, show empathy, don't argue. Okay? And go with the defenses. Don't attack his defenses. Okay? Go with the defenses. And then discuss what are the advantages of drugs and what are the disadvantages of drugs. Okay? And how would be his life if he doesn't stop drugs after, say, 5 years, or say after 10 years? Where would he stand after 10 years or after 5 years if he doesn't give up drugs? And where would he stand if he gives up drugs after 5 years or after 10 years? ठीक है? अगर आपने ये ड्रग्स ना छोड़ी तो आपकी जिंदगी 5 साल बाद कहाँ होगी? फैमिली के लिहाज से, काम के लिहाज से, सेहत के लिहाज से आप कहाँ खड़े होंगे? आप 10 साल बाद कहाँ खड़े होंगे? और अगर आपने ड्रग्स छोड़ दी तो फिर 5 साल बाद आप कहाँ पे पाएंगे अपने आप को? 10 साल बाद कहाँ पे पाएंगे? ठीक है? And meanwhile, you keep on, encouraging him, reassuring him, increasing his self-esteem, और आप उसको encourage करते हैं कि yes, you can do it, yes, you can do it. It's difficult, but you can do it. Okay? So this is how you motivate. Empathy and non-judgmental attitude, no arguments, no attacking his defenses, go along with the defenses. Okay? Cost benefit analysis. Okay? And increase his self-esteem, confidence, and self-efficacy. That's how you motivate a person with drug dependence. This specific technique of motivation is called motivational interviewing. Motivational interviewing. You can see this in, internet. So motivation is a very important component of management. Am I clear? Once a person is motivated, then you can decide to treat him indoor or outdoor, depending on the type of drug and severity of the problem. And at the same time, you will be taking measures to prevent the patient from harming himself or others, and informational care for the patient and for the family. These are the same points, okay, which you need to mention in each disorder. You would be treating any complication or comorbid physical psychiatric disorder like depression, and you would be detoxifying, that is planned withdrawal, okay? There are various methods of detoxification. For example, one method is cold turkey method. For example, in heroin withdrawal or nicotine withdrawal, the drug is withdrawn suddenly, and whatever the side effects occur, withdrawal symptoms occur, you treat it accordingly. For example, if there's vomiting, you treat vomiting. If there's diarrhea, you treat diarrhea. If there's infection, you treat infection. If there's dehydration, you treat dehydration. So this is called cold turkey method. But not every drug can be treated in this manner. For example, uh, you cannot withdraw benzodiazepine or alcohol suddenly, because then the person can go into delirium tremens or can have fits. So in that case, you would be adding, benzodiazepines, and gradually you would withdraw it, or you would be adding anti-epileptic drug. In the case of heroin withdrawal or opiate withdrawal, you can also give synthetic opiates. Okay, uh, and that helps in managing the symptoms. Various psychotherapy, family, marital, and group therapies. Group therapies are effective in drug dependence. Okay, and support groups like Alcoholic Anonymous or Narcotic Anonymous. We would be coming to this. Okay, there's surveillance and follow up and rehabilitation. Okay, and of course you would be covering these aspects: dietary advice, exercise and other activities, stress management, and problem solving, social skills, mindfulness skills. You would be building skills, social skills, interpersonal skills, intrapersonal skills. One important tip is that the person is getting some pleasure and some reward from a drug. So when you stop that drug, when the person becomes abstinent, so he loses that important source of pleasure and reward. So if you want your program rehabilitation to be successful, you need to replace drugs with some other activities, some pleasurable activities, some rewarding activities. For example, exercise or some social activity, okay, or some thrilling activity. So drugs should be replaced with some constructive activity. These techniques are given in your book, especially when one is abstinent. Okay, so he can use whenever there is craving, he can distract himself with some activity. He can delay the response. For example, if a person has craving for cigarettes, he can say that, hold on, I would not act on this impulse, and I would see after 15 minutes. So that delay would help him to control that impulse. Okay, and not giving into the urge. Deep breathing exercises, physical exercises, escape from the situation, from cues which might lead to relapse. Positive statements that I'm doing fine, I can handle it, I can remain abstinent, and work on thoughts, cognitive restructuring. Okay, so you can teach your client different techniques. And now I'm coming to a very important uh, aspect, and that is spirituality and religion. Okay, this is one area where the Westerners thought, whereas the Westerners found that religion and spirituality was very effective. They could not, treat drug dependence with any other technique or psychotherapy. So they turned to the spirituality. Okay, and they devise a program which is called 12-step program. Okay, 12-step program, and this program is used in group format. Okay, and there are various groups, self-help groups, Alcoholic Anonymous and Narcotic Anonymous, which use these 12-step program. So this 12-step program is purely based on spiritual principles. Okay, uh, and it focuses on humility, acceptance, and surrender. For example, first step is that a person says that I have become helpless and my life has become unmanageable. Okay. Then he says that there is a higher power which can help me to return to sanity. And then he says that he is handing his will and life to this higher power or God. So this is acceptance and surrender. Okay. The next steps are action steps. 9 steps are action steps. He forms a moral inventory that what wrongs he had done, and he then seek forgiveness from other people, and he seeks reparation to people to whom he had harmed, and he develops a connection with God, and he engages him in service of his fellow drug addicts and other people, and he engages himself in prayer and meditation. So these are 12 steps, and each step, is discussed in one session and in a group format. Okay. So this 12-step program has been found very effective in the treatment of drug addiction. Okay. So people with drug addiction or drug dependence, need a greater, an immense psychological change, but they cannot do it on their own. They need to resort to a higher power, and higher power in our context, in our culture, in our religion is Allah Ta'ala or God. Okay. So thank you very much. Thanks for listening. Any question? One slide is left. So how to prevent drug dependence? Okay. So there are control strategies, educational strategies, and provision of alternative. Control is legislative, administrative, okay, financial, education of general public, young people at risk groups, and provision of alternatives, promoting alternative layer activities, harm reduction. Okay. And there were some slides about cigarette smoking, but there is no more time, so I cannot go on these slides. Anyway, you can study the content in your book and other, content in the internet or in other books. Okay, and whenever I would get opportunity, I would, talk on this topic. Any questions? Any question? Thank you very much. I hope that now you are familiar with the scheme of management which you can, use in every disorder. So आप सब लोगों को पेश की ईद मुबारक. Have a nice time, and I hope that you would be able to come very soon to the college. तो अपना ख्याल रखिएगा, अपनी एहतियाती तदाबीर का ख्याल रखिएगा, और पेश की ईद मुबारक आपको और आपके फैमिली मेम्बर्स को। अल्लाह हाफिज़।